Hello, my name is Lisa De La Serna. I will be presenting my informative speech. I chose to do my informative speech on mental health illnesses, specifically talking about OCD, obsessive compulsive disorder. So first, what exactly is a mental illness? According to the American Psychiatric Association, a mental illness is any health conditions that involve changes in thinking or behaviors, or it can be a combination of both. As I said, I will be informing you on OCD, specifically obsessive compulsive disorder. I'll be informing you on what exactly is OCD, who it can affect, and any signs and symptoms and treatments for OCD. So what exactly is obsessive compulsive disorder? It's a common mental illness. It's chronic. It is long-lasting. It's pretty much where a person has uncontrollable thoughts, recurring thoughts, that would be the obsessions, and any recurring behaviors, that would be more the compulsions. With the obsessions and compulsions, they feel the need to, they have this urge to want to repeat it over and over again. Who can all get affected by OCD? There's really no age range. It can be children to adults, specifically targeting an earlier onset on boys than it is for girls. The diagnosis usually has been known to start around 19 years old, but anyone up to 35 years old can also be diagnosed. They are still checking if there's any common grounds through genetics, but they have found that it is connected with first-degree family members, so, parents or siblings. There is a brain connection with OCD and any abnormalities, but the research is kind of unclear. People who suffered from abuse, they're most likely at a higher risk than others that have not been or that have not suffered from abuse. Even though the cause is unknown, everything listed that I just talked about, these are what makes a person have higher risk factors. The signs and symptoms of obsessive compulsive disorder. I'll start with obsession first. These are repeated thoughts or any urges and mental illnesses or mental images. I'm sorry. Examples for this can be fear for germs. They can have taboo thoughts on sex, religion, or also causing harm. The harm can be aggressive towards other people or themselves, and they could also have issues with having things in a symmetrical order, so pretty much being in a perfect symmetrical order. With compulsions, the compulsion can be the urge to have repetitive behaviors, and the behaviors are a response to the obsessive thoughts. Examples for the compulsions would be repeatedly cleaning things or an object, washing your hands over and over, arranging things in particular ways, also repeatedly having things being checked, so checking locked doors several times, setting an alarm for a car several times, things like that. Also, compulsively counting would be an example of compulsion. Not all signs and symptoms are considered to be compulsions. They do have issues where are examples of when people know they're doing these repetitive behaviors over and over, and they know it's excessive, but they still continue to do it. So they're aware of it. Even though a person with OCD will perform the compulsion over and over, it may not always give them a satisfied feeling. It would just kind of ease the feelings inside, but it may not always be a satisfying feeling. They may not always be fully pleased. This is something that really bothers a person. It's something that can alter a person's daily activities in life. Some other signs and symptoms that a person can have can be motor tics. Along with motor tics, they can also have vocal tics. Examples of motor tics would be shrugging of the shoulders, fast blinking of the eyes, rapid eye movements, things like that. For vocal tics, they can have clearing of the throat, often clearing of the throat, the sniffings, okay, things like that, and also coughing, constantly coughing, or like I said, clearing of the throat. Treatments and medication. Treatments would be medications. They also have a psychotherapy, and sometimes they do an incorporation of both. Medications, they would go for antidepressants to try to ease anxiety, because this does cause anxiety. The medications have been proven to be effective. The psychotherapy is CBT. It's cognitive behavior therapy. They do have different tools on how they do CBT. They base it off a model, and what the model is that the way that an individual perceives a situation, that's what's more closely connection to their reaction of the situation itself. So pretty much what they do is they try to target and change the thought process of the outcome of why they're doing something, and not the reason why. It's kind of done by behavior therapy is what it is. Acceptance and commitment therapy is involved. They do a lot of other psychological therapies, but it's really them trying to change the thought process on why they're doing something, not the ending of the outcome of what they're doing, but why they're doing it in the first place. So that's what they're targeting. There's a lot of misunderstandings about OCD, which is why I think I chose to do my informative speech on it. According to health.com, and a person suffering from OCD, they are judged as clean freaks or as organized junkies, or sometimes people even call them crazy for being too quote unquote anal on repeating things or doing things over and over. Little do some people know that this is actually a pretty severe situation, a severe illness. It causes severe distress on a person mentally and also physically. Hopefully I've taught enough about obsessive compulsive disorder. This OCD is a type of anxiety. They don't consider it a psychosis, so it has nothing being related to psychotic. It is, again, a mental illness. So hopefully I've explained enough to get some of you to understand that it is pretty serious. All right, thank you.